Years ago, a patient came into my office terrified that she had skin cancer. Her eye doctor sent her to me because she had this dark, slightly raised area just underneath her upper eyelid skin. So I took her into my procedure room and out came a chunk of black, flaky material. As I'm looking at it and trying to understand it, I noticed that she has a previous scar from upper eyelid surgery. So that black, flaky material, not melanoma. It was mascara. So I then asked her when she had got her upper eyelid surgery done. Oh, like 5 or 10 years ago. So that icky black chunk of mascara that I had pulled out had been in her eyelid for like a decade. Yuck. Ugh. I'm Dr. Kian Eftekari, oculofacial plastic surgeon specializing in eyelid surgery. And today I'm going to tell you the one mistake that can genuinely derail your recovery after surgery. And at the end, I'll give you a bonus tip on what you actually can do to look more put together after surgery without taking that risk. Stay with me because this is the thing that nobody tells you before surgery and you really need to know it. Here's why this happens so often. I tell everyone in my practice that they will have 1 to 2 weeks of bruising after upper eyelid surgery, sometimes more. And strangely enough, some people come out of eyelid surgery and they feel just fine. Maybe a little swollen, a little bruised, but fine. And they look in the mirror and they think, okay, I'm good. I just need a little concealer, a little mascara, nothing too crazy. And I completely understand that instinct. You're a human being who's used to getting ready in the morning. You have places to be. Who in the heck wants to walk into work looking like they went 10 rounds in the boxing ring with Mike Tyson or bang their head into the kitchen cabinet? So the temptation is real, I get it. But here's what you have to understand about what's actually happening underneath the skin in the first days after surgery. Your eyelid is healing from the inside out. The incision site has stitches to kind of close it on the surface, but those tissues are actively repairing. The area is essentially an open wound that's been carefully brought back together by the stitches. That area is not sealed up. Think about it like you just painted a wall and the paint is still wet. Are you really going to open your window and let a bunch of leaves blow into the house and ruin your freshly painted wall? Or are you going to let it dry like you know that you're supposed to do? Nobody wants to scrape and paint that wall again, just like nobody wants to fish out 10-year-old mascara from somebody's eyelid. And yet that's exactly why I'm making this video, because I've already had this happen to me. So besides getting a chunk under your skin, why is it bad to apply mascara or eyeliner after eyelid surgery? First, pigment migration. The skin around a healing incision, it's not a tight barrier yet. Tiny pigment particles can actually work their way under the healing tissue and get trapped. Second thing is the infection risk. Mascara wands are one of the most contaminated tools in the average person's makeup bag. Studies have found bacteria living in used mascara. So please hear this clearly. Do not introduce bacteria to a fresh surgical site. That's the setup for an infection that could compromise your result and ruin the surgery you spent so much money on because you simply couldn't be patient for like 10 days. I'm telling you, it's not worth it. So when can you wear makeup? Let me give you a realistic surgeon's view timeline. Days 1 through 7, nothing. I mean it. No mascara, no eyeliner, no eyeshadow anywhere near the incision. Your sutures are fresh. This is the highest risk window. Don't even think about it. Week 2, external sutures, if you had them, are typically coming out anywhere from days 5 to 10 or sometimes even up to 14. Depends on the surgeon and your own individual body. The area is still healing. You can start to think about makeup on other parts of your face, foundation for your cheeks, lip color, whatever, but stay away from the eyelid area where the sutures are. Any shadow, liner, or mascara is still off the table. After 14 days, then I think you are good to go for those things, but make sure to check with your individual surgeon. Don't listen to that person on Instagram who won't be there to help you if you have a complication. Don't listen to your best friend who had a different procedure, and definitely don't listen to the devil over your shoulder in the morning telling you it's fine when you're heading to work. If your surgeon hasn't given you specific guidance on makeup timing, just ask them. All right, so your surgeon says you're cleared. What does safe re-entry into makeup actually look like? Rule number 1, start with a clean, fresh mascara wand in a new tube. Your old mascara has bacteria in it. Don't bring that near a healing eyelid. Rule number 2, try to keep the mascara, if you're going to use it, on the tips of your eyelashes, not at the base. The base of the eyelashes is right at the eyelid margin, right near where your incision lives. Keep some distance. Rule number 3, remove makeup gently. No rubbing, no pulling. Use a non-oily, fragrance-free remover and press on those areas. Don't drag across. Rule number 4, stop immediately if you notice any increased redness, swelling, discharge, or itching at the incision site after wearing makeup. Redness, swelling, and discharge could be the sign of an infection, Itching could be the sign of an allergy like contact dermatitis. Those are signs of irritation or early infection. Go back and see your surgeon if that happens. And here's something worth saying plainly. The outcome of your surgery is partly determined by how well you heal. You can have a technically perfect operation and still get a bad result because of what happened during your recovery. Your surgeon did that part. Recovery is yours. Okay, I promised you a bonus tip, and here it is, because I'm a surgeon, not a monster, and I know people have lives to get back to. There is one thing you can use earlier in your recovery to look a little bit more put together without jeopardizing your healing. A mineral powder, preferably with SPF, in a skin tone shade applied away from any of the sutures. Specifically something like a loose mineral powder that comes with a brush, skin tone shades only, no pigment, nothing shimmery. If you had upper eyelid or brow surgery, you will likely get some bruising under your eyes and your cheeks. You can even do the brow bone if needed or other parts of the face, just not on or near the incision or on the lash line. Why does this work? A few reasons. Mineral formulas tend to have simpler ingredients with less irritation potential. The brush application is light, it doesn't require rubbing, and then once you're past that 10 days out from surgery, you can actually put this onto the suture line, which will help conceal it. This is critical because sun protection is actually your friend during recovery. That's why SPF can really help. If you get UV exposure on a healing scar, that can cause hyperpigmentation. So what is hyperpigmentation? Hyperpigmentation is darkening of the scar, and sometimes that can mean it gets thicker and not so good looking. Protecting that area from the sun helps your scar heal lighter and flatter. So a skin tone mineral powder used carefully and away from suture lines gives you a little coverage and sun protection without the risks of a traditional eye makeup. That's the thing I actually tell my patients. Just stay away from the eyelid itself until you're cleared. Everything else can wait. So to recap, the one mistake that can ruin your eyelid surgery recovery is using pigmented eye makeup, mascara, eyeliner, eyeshadow, before your surgeon has cleared you to use this. And even then, there's a right way and a wrong way to reintroduce it. The patient I told you about at the start, she was fine in the end, but she had the anxiety of worrying she had a melanoma, plus an extra procedure by me that she wouldn't have needed if she just waited a few days. Oh, and one more thing. Please don't be that patient that shows up to surgery wearing a ton of makeup, mascara, eyeliner, and eyeshadow. I have to wipe it all off, you're gonna lose eyelashes, and you're gonna regret it. The biggest thing is if you show up to surgery with a bunch of pigmented makeup on or even false eyelashes, that's going to increase your chance of having an infection after surgery because as we're wiping all that stuff off, some of the bacteria can get under the wound, which is not what we want. If you found this video helpful, hit subscribe. We put out honest surgeon-level breakdowns of eyelid surgery on this channel, and I'd love to have you stick around. And drop a comment below if you have a question about your own recovery. I do read them. Thanks for watching. Now go take that mascara wand and put it in the drawer for a few weeks. Your eyelids will thank you.